More than 36 million Indonesians are people living with disabilities and marginalized community members. Unfortunately, that relatively large population still got left behind in disaster management, including in the COVID-19 pandemic. Whereas, as Indonesian citizens, we all have the rights to equal protection. So, what should we do to ensure the pandemic handling is inclusive and leaves no one behind? Here are some key learnings from the Inclusive COVID-19 Risk Communication Program, Lean On by InvestDM. First, ensure inclusive access to information. Although there is wide circulation of COVID-19 information, many marginalized community members cannot access or digest them well. So, we need to ensure that COVID-19 information gets communicated according to various needs of the marginalized groups. For example, delivering information in audio format for persons with vision disability, involving a sign language interpreter, and adding subtitles to audiovisual products for persons with hearing disability. Remember, there are two types of Indonesian Sign Languages. Make sure the type of language suits the needs of the target audience. Don't forget, whenever possible, use illustrations, colors, font types, and sizes that are in accordance with the needs of the target audience, and to translate the existing information into the local language and dialect. Remember, elderly, adults, and children have different abilities in absorbing and understanding information. The elderly are usually more comfortable receiving information in their local language. It is also important to provide a region-based one-stop source of information that are easily accessible to everyone, including persons with disabilities or their caregivers, and hotline services from the authorized entities to verify the circulated information or deliver feedback about the pandemic handling. Remember, some people don't have access to internet or cell phones. So, offline and easily accessible one-stop information source and hotline services should also be available. Second, methods of prevention education should also be inclusive. Outreach for marginalized groups should be carried out by peer supporters from their respective communities, because the peers are usually more trustworthy and understand the effective means of communicating with their fellow community members better. Outreach activities can be carried out in groups or individually according to conditions and needs. For example, PLHIV or people living with HIV/AIDS are used to and comfortable with group counseling. People with vision disability prefer individual session with storytelling method, while children prefer learning through playing with parents or caregivers' companion. Remember, make sure the outreach tools and media are accessible and well understood by each target group. Additionally, educators should also master the local language or the type of language familiar to the community. Also, don't forget to always involve the local government and respected community leaders in fighting against stigma towards COVID-19 patients. Remember, people usually need role models from the community or their immediate circle so that the domino effect of behavior change can happen. It is also important to ensure that the supporting facilities, such as hand washing stations, are available and accessible to everyone, including persons with disabilities. In addition, community-based sanctions can also be an option to enforce preventive behavior discipline. Remember, without properly accessible facilities, it will be difficult to enable behavior changes. Third, there needs to be two-way communication between policymakers and marginalized groups, since strategy development and work planning not only during the implementation. Pandemic risk communication activities will be more effective if officers and volunteers at the grassroots can coordinate with respective task forces and duty bearers. Do not forget that the coordination also needs a community accountability and reporting mechanism, both for the progress and results of outreach activities, and for the information and public services gaps found and experienced by marginalized groups. It is also important for all stakeholders, including the central government, local governments, task forces, non-governmental organizations, and civil society organizations that are working in pandemic handling to form and strengthen working groups. These key learnings are expected to help improve the strategy not only for pandemic risk communication but also for other disaster risk communication. For more inclusive disaster management, the representatives of vulnerable and marginalized groups should be engaged since the strategy formulation through impact monitoring. Let's be more inclusive so Indonesia will be more resilient.